Okay, I'm going to show you my audience for my speech today. Make sure my visual's in there. Okay. Alright, so today I'm going to be talking about anxiety. Have you ever experienced extreme fear, avoidance, pain, or anxiety about something you've said? It could be your mental health, specifically anxiety. Our fears come from concern of starting a task or being able to finish the task successfully. This can turn into avoidance, so we do not have to face the fear we have or face reality of acceptance, success, or embracing failure. We worry about others' approvals. We become afraid of rejection or not being accepted. Sometimes we're anxious to join in a social setting, afraid we'll say or do something wrong. Living with this constantly is living with the mental disorder we call anxiety. Anxiety is serious. However, episodes are able to be supported and are treatable in the right setting. The purpose of this discussion is to learn about anxiety so we know what signs to watch for and how to be more accepting and understanding of those around us if they exhibit these signs. To start, the definition of anxiety is an emotion characterized by feeling of tension, worried thoughts, and physical changes like increased blood pressure. People with anxiety disorders usually have recurring intrusive thoughts or concerns. They may avoid certain situations out of worry. According to MayoClinic.org, common anxiety signs and symptoms include feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, rapid breathing, sweating, trembling, feeling weak or tired, trouble concentrating due to worry, and having the urge to avoid things that trigger the anxiety. Next, we need to acknowledge support. When we notice someone having signs of anxiety disorder or attack, it is important to acknowledge that anxiety. It is noted on verywellmind.org that psychiatrist Gail Saltz, MD, Associate Professor of Psychiatry in the NY Presbyterian Hospital School of Medicine, acknowledges that we can lower anxiety through meditation practice, exercise, deep breathing, or talking to a therapist. She reminds us that we can also listen and help facilitate a plan with a person suffering from an attack, by simply listening to them and encouraging them to reach out for support. Finally, it is important to recognize that as a supportive person, you also need to set limitations. If you're in a relationship with someone who's dealing with anxiety, it is recommended that yourself talk to a mental health expert who should have a better understanding of what your role is and support as a support person and how to manage your own emotions when helping them deal with an anxiety attack. Psychology Today magazine shared an article also adding that it is important to be able to support and balance anxiety thoughts in your loved ones. An example provided in the article would be certain triggers, including not receiving an email reply right away, may trigger thoughts that this may imply bad news. Being timely for the individual with anxiety would be of importance in order to support their well-being. Throughout all of this, it's important to remember that anxiety can be managed with the support of loved ones, doctors, and mental health professionals. Now your resources, which verywellmind.com lists recommended sources include Anxiety and Depression Association of America, National Alliance of Mental Illness, National Institute of Mental Health, Substance Abuse and Mental Health Services Administration. In an article, How to Find Help Through Seeing a Psychologist, Psychology Review magazine, it offers guidance to find support in your area. This article suggests talking to close family members who may be aware of local services or have a good experience. Talk to your place of worship or ask your primary care provider or health professional in your area for a recommendation. I interviewed Jennifer Caldwell at CETA Behavioral Health and Treatment Services, who was able to list local services offering support for people dealing with anxiety, including River Hills Community Health Center and Southern Iowa Mental Health. Ms. Caldwell reported that most providers accept all insurance. However, River Hills can go off of a sliding fee scale to support someone and lowered payments in order to receive services. Anyone could be affected by anxiety. I hope this information helps you understand how to help someone with anxiety in the future. Thank you. And I'll show you my audience again. Okay, thanks.